Colorectal surgery or bowel resection can be very painful, and patients are at risk for complications. It's now been shown that a transversus abdominis plane block,
That sounds complicated.
well, we're going to
Wow.
abbreviate it TAP or
Okay.
TAP, and it can improve the outcomes as well as other protocol. So, what is a TAP block, and how can this reduce complications from having these surgeries?
Right. Isn't it interesting we're talking about something like this because it's not our character. We don't really bring these kinds of things into our shows because they're complicated. But there's a reason why we're doing it. We'll get to it in a minute. But basically, what it is it's addressing the problems that we see when people have any kind of surgery. They have pain afterwards. And when you have pain afterwards, it leads to use of narcotics. It's constipating. It makes you mentally not quite right, and very often can lead to problems that keep you in the hospital. It costs more money. All it is an injection of lidocaine or something like that in between the muscle planes of the abdomen, which is where the surgery, of course, in this setting occurs. And when that happens, the results are better.
Well, it helps the patient to not or to get over the hump of the worst pain.
Exactly.
I remember when I had shoulder surgery for a
Oh, right.
rotator cuff that was really destroyed. And when that block wore off,
Oh,
my
the pain was
goodness,
horrible.
the pain was just unbearable.
Sure. It's the same thing for me when I had my hip surgeries. The pain right after surgery is a real issue that gets your attention.
When the anesthesia wears off.
Exactly.
Yeah.
So really what we're looking at here, let's just describe the study a little. This was done and published in the Journal of the American College of Surgeons in September of 2013. And what they found is about 10% of patients who had colorectal surgery were readmitted within 30 days and 20% within 90 days. That's a lot of people. And the study was done at the Case Reserve Medical Center, and they did this procedure. And what they found is they could shorten the amount of time that people were in the hospital from 5 or 6 days if they did it laparoscopically, or 9 days if they did an open surgery.
I thought it was interesting that patients that stay in the hospital the longest amount of time have more complications.
Well, actually, they said that, but I'd turn that the other way around. The people who have the most complications stay in the hospital a little bit longer. And somewhere around 17% of patients who have this surgery are having complications.
Well, maybe we should talk about what complications can arise from this.
Oh, sure. Bleeding and infections are the big things. With bowel obstructions come from a surgery like that because it can lead to a fibrotic band that can block the lumen of the intestine, which is a big deal. So this is a big issue, but the point they're making is well taken. The reason we're presenting it is to make that point, but also to point out that it's not the only way to go.
There are other things that can reduce pain.
Absolutely.
We'd love to see hospitals incorporate some of the other
Modalities.
holistic and other modalities because they don't have the side effects of the pain medicines and so forth. Things like acupuncture. You know, many of the hospitals talk about how they have acupuncture, but the acupuncture is outside the hospital.
It's
like
in an outpatient clinic.
In their clinic.
Show me one hospital that's learned from what we learned when President Nixon went to China and came back with a video that showed us a picture of somebody having open chest surgery, eating an orange, and a few acupuncture needles in their neck and no other form of anesthesia.
And when I was a student nurse, I watched a cesarean section with hypnotherapy.
Wow, that's amazing. How often do you see that happening either? Or how often are we looking at things like infrared light therapy, which should be used in every single patient post-operatively?
Well, it also helps the healing.
Oh, for sure.
Reduces the inflammation, helps the lymphatic drainage, all that.
It does that. It increases circulation, and it relieves pain. And you'd find the same results generally, in my opinion, just by using a non-invasive light that you'd shine on the scar or the area where the surgery was done for 5 to 10 minutes.
Well, anyway, if a person goes home sooner, they have they're less often readmitted to the hospital. That was what they found in the study.
Yeah, I think that's right. So we should learn from this study, but we should also point out that the technology they use is not one that we would support. I think that using hypnotherapy, using acupuncture, using homeopathy and infrared light therapy.
And then if
all would
that
be-
doesn't work, then maybe for a last
Maybe.
resort to use this other thing. But
So, as usual, what we're talking about is saving the most aggressive kinds of therapies, which are often the primary thing we use in medicine, as the last choice, not the first choice.